Hi, it's Dr. Bob at Conquering Migraine. Happy to have you guys back. Today's topic is why do supplements or some supplements work for some people and not work for other people? And that's a great question. And the same question could be asked of medications. And so my answer to that is it's not just hit or miss, but there is some precision to this, but it's an imprecise precision. You go, well, that sounds annoying, and imprecise precision. So we can categorize and group things and figure out which things are most likely to respond. So for instance, there's a condition called migralepsy, where a patient has migraine and epilepsy together. So sometimes we try to get 2 for 1. We try to get something that will help both one problem and the other problem at the same time. And so in such a patient, we might use a seizure drug like topiramate if it was the correct type of seizure drug for their seizure, and also to help their migraine. Also, we know, especially with migraine with aura, that there have been very good studies that show that slow wave spreading depression, where a wave of depolarization goes across the cortex, the surface layer of the brain, from the back to the front, very slowly, at 2 to 3 millimeters per minute, and it depolarizes or changes the electrical activity of that part of the brain. Now, epilepsy or seizures have that same slow wave depolarization. So in that type of patient, the same kind of medication that clearly affects that, and many preventive migraine strategies and medicines do, might be a good idea. And then for supplements, some of it would be the same type of thing. And so that sort of leads into what kinds of things can cause that situation. And so, for instance, in our frontal facial subtype of migraine, we would say we have a certain set of supplements that often work. They help sinuses, they help food sensitivities, they help reactions that cause sinus congestion and things like that. But let's say instead of, maybe 70% of people who have their frontal migraines might have a component of sinus congestion. But 30% of people might have other things, and that in that other basket might be something like clenching the jaw. And so if you had jaw clenching, then a splint from your dentist or biofeedback or certain prescription medications that affect jaw clenching will help you. And so as we get more and more precise, so for instance, within the facial subtype of headache, there are several subtypes. There's a kind that's related to a dental abscess or a dental problem. Well, you can take a lot of supplements or a lot of prescription medicines, or there's a type of headache called a sphenoid sinus infection, and it's always on the headache boards. And so the sphenoid sinuses are right back behind the head here, and they are notorious for causing super severe headaches that even narcotics won't help. And so in that situation, you say, well, why didn't a supplement help this? Or why didn't a prescription headache medicine help that? Because you had a severe infection and your whole sphenoid sinus was full of blood, pus, mucus. It's causing pressure on the bone and causing pressure on all the areas around there and all the sensitive receptors in the lining of the sphenoid sinus. And so almost any kind of medication, even a strong narcotic, is not going to help a headache like that. So part of it's about precision and part of it's about grouping. And so, for instance, magnesium is one of my favorite headache supplements because it's what's called an NMDA receptor antagonist. So there are 3 types. The main excitatory neurotransmitter that's overactive in people with migraine is called glutamine. And there are 3 subtypes of glutamine receptors, AMPA, kainate, and NMDA. And so overactivity of things that stimulate NMDA receptors causes the brain to be twitchier. When the brain is twitchier, then the migraine thresholds are lower, and it's more likely that anything will trigger them off. So if we do things that raise those thresholds, like making sure you have sufficient magnesium and sufficient balance of chemicals and sufficient amount of sleep so your brain can clear out all of the toxic metabolites and chemicals that build up, you go, what toxic metabolites and chemicals? Well, for instance, the brain has a lot of mitochondria. Mitochondria are like nuclear power plants for cells. That's where they combine oxygen with fuel like carbohydrates or fats and burn it and give off massive amounts of energy compared to what you can get without using oxygen. Without using oxygen, you just sort of drip energy in like 1 ATP at a time. But with using oxidation, you create these intense reactions and you're able to capture most of that energy. But you also create nuclear waste, not really radioactive waste, but you create waste of making energy at that high in intensity. And so that waste might include things like reactive oxygen species or free radicals, these chemicals that have been oxidized and they can attach onto other things and damage them and cause problems. And so we need to think about sort of all the things that can cause problems. And so, one of the things we do is we use antioxidants to quell inflammation that can be caused by problems like overactivity of reactive oxygen species. And if the mitochondria in the brain are not doing well, then the brain doesn't get enough oxygen. So the brain needs enough glucose or fat for fuel, needs enough oxygen to burn. So one of the quickest ways to kill somebody is cut off the oxygen to their brain and their body. And so if the brain doesn't get blood flow, or if it doesn't get oxygenated blood flow for even as little as 2 minutes, somebody can have permanent brain damage or die or things like that. As it gets closer to 5 or 10 minutes, then the chances that you're having serious brain damage go up and up and up, unless you're hypothermic or have some other thing that's put your brain in a state of not needing a lot more activity and a lot more metabolism. So the answer is, so back to that frontal headache, it depends on the details of the subtype. So someone might have a sinus-related problem, and a lot of times that's related to a food sensitivity or an allergy or chronic inflammation. It might be from pollens. It might be classic allergies where you also have nasal stuffiness and red and itchy eyes and sneezing and dripping a clear mucus down the front and the back of the nose, maybe your ears itch, and sometimes asthma goes along with that. Might be that. But it also might be something mechanical. There's a thing that headache meetings I go to called touch points, where 2 bony points in the nose actually touch. And that's thought by some ear, nose, throat doctors and some headache specialists to cause problems. Well, is the supplement going to make those bones any further apart? Like, I don't think so. And what if your sinus, the openings to your sinus, the ostia that open from the nose into the sinus, what if those are too small? And so I had a patient in last week who said, I used to have a lot of headaches, used to have a lot of sinus problems. But then an ear, nose, throat doctor went in and they made those openings bigger, so that instead of just a single mucus plug being able to fill up a tiny hole, I had a much bigger hole from the sinuses out. And so a tiny mucus plug doesn't really take up the space. It's sort of like, why do kids get more ear infections? Well, kids get more ear infections because the tube from the ear to the throat, the eustachian tube, is small. And so if it gets congested, it swells up a little bit, it swells shut. As they get bigger, that tube straightens out and the tube gets bigger. And so if it swells, it's still open. You still are able to aerate the ear. If you aerate the ear, you don't build up fluid. If you don't build up fluid, you don't get infection. So lots of times it depends on the cause of the root cause. So we break these into groups. So it might be sinus. So one of the things you do if you think you have sinus is you go to an ear, nose, throat doctor, your regular doctors, emergency room doctor, whoever is going to take care of you for that, and you get a CT scan of your sinuses, and then maybe you have an ear, nose, throat doctor look up in there with a scope and say, are your sinuses filled with blood, pus, and mucus? Are they blocked off, and are they like half full, where you have like an air fluid level in your sinuses, or are they completely filled, which is called opacification? And so we look for causes like that. But like we said, it could be arthritis of your jaw joints. It could be bruxing or crunching your teeth all night. It could be a dental abscess. And so a lot of those things are all related. And so why would a supplement that is good for food sensitivities or allergies not help a frontal or sinus headache all the time? Well, it's probably not going to help a jaw joint headache very much, and it's not going to help an abscess or an infection. You're probably going to need to not just take antibiotics for the infection, which sometimes would make it better, but a lot of times an abscess needs surgical drainage. They got to drill up in there, let the pus out. When that happens, people feel dramatically better. I've had dental abscesses, and I know how painful they are. They throb. I've actually also had discussions in this group and in our other group with people who had sinus infections, and they had dental problems, and they had migraines. And so we're able to sort out that sometimes when that nerve is sensitized, that branch of the trigeminal nerve is sensitized by like a dental infection or a dental abscess, for months afterwards, whenever you get a headache, that nerve may light up because it's already partially turned on. It's already irritated. It's already, got all of its fibers partly activated. So when a migraine comes, it goes down that pathway more and makes that particular nerve throb. You feel it in your tooth. And so once an area is sensitized, then it's quite possible that it will continue to go on. So that's my answer to why will a supplement sometimes help a headache and other times not? Why, even if it's the right subtype of headache, why won't it help? Because there are a variety of different causes of that. So in the back of the head, sometimes it's muscle, sometimes it's an arthritis condition where there's a severe arthritis in the upper spine, and other times it's tension in the mid-back. And so all of those things together can contribute. And so as we get more precise, the subtype is more precise than I just have a migraine, and then we go into that subtype in all of the education and detailed teaching we do in our our courses and programs of, well, what are the different things within that subtype, and how do we get to the bottom of them? How do we treat them? How do we recognize them? And then what are the pathways to healing for each of those? And that's part of our more extensive teaching programs. So I hope that answers a little bit of question about why sometimes a supplement will help something, or even a prescription medicine will help something, or even why a headache may not respond even to strong narcotics. And if you ask the question, will this supplement help? I would use the answer, it depends. And so I had a friend who was a lawyer, and all the time, every time we'd get together on the weekend, I'd ask him a question. I'd half the question, he'd answer, it depends. And so within the migraine subtypes, it does depend. It depends on which branch of the nerve is involved, and it depends on what kinds of things are triggering that. And so as we get into subtypes, we dissect and delve into those further and further. We unpack those, we take it apart, we look at the kinds of things that heal it, and then we also look at the other things in that bucket to say, what are the other things we should think about addressing if you're having pain in that region, or that pattern of pain, or those kinds of things going on. So I hope that's of value. You all take care. Dr. Bob, over and out.